I'm Dr. Garrett Katula. I work for Rush Katula Medical Group. When I think about my personal style, I generally try to be down to earth. I am a local guy from a Midwestern town. I grew up in a small town, so I like to think of my practice as being an old-fashioned family practice. When someone leaves here, I'd like them to think that someone really cared about them and listened to them. Being a family practice doctor, we are able to see everyone from the time they're born, and that really helps us because we are intimate with all aspects of the patient and their family. Being able to know people from a very personal level helps us treat them on a very personal level. We can make treatments, we can make decisions, we can make management choices that revolve around all the people we know and what impacts them and impacts their lives. Well, I love treating children. That's one of my favorite things. I'm a father of 3. I like to take what I've learned being a father and take that to my patients. I know what it's like to walk through the supermarket and see how many different baby formulas there are and all the different safety devices, and I've been there at night when the child has 105 fever. I know what that's like. And I like to help other families get through that. We're part of a small community here, and being in the small town, my kids are involved in all the same sports and all the same activities that everybody else is. Having kids and having my own family is very impactful for how I get to treat the people who bring their kids in here. I like to treat every kid who comes in here as they're one of my own. When we think about what's dangerous for our kids, we do a lot when it comes to making sure their throat's okay, making sure their lungs okay. Of course, that's part of a regular visit. But what we also do is we like to look at what things impact the kids that could be a potential problem. When I like to see the teens, some of the things I like to talk about is, are they involved in different activities? What are the risks with those activities? And some of that can involve drugs, some of that can involve alcohol, and we like to put it into a framework that the kids understand. If you're at the movie theater and someone's going to drive you home, was that kid drinking? My hope is that when they're thinking about it afterwards, or when they're in a situation, we can kind of have them pre-think or pre-prepare themselves for what they are going to do in those situations. And if we can impact 1 or 2, it'll make a big difference. Treating the elderly is a very unique experience, and it's very rewarding. In fact, when I first went into medicine, I was intimidated by treating the elderly. It's a hard thing to do. It's very complex. As I've been in practice longer, not only have I found I enjoy that more, but I've also realized that it's much more impactful as a physician. Helping people through the end of life is one of the most rewarding things we do. As a primary care doctor, we often don't have the big saves. No one runs to us and says, boy, thanks for doing that surgery, or thanks for fixing my broken leg. But the times that we do get thanked are when we help someone navigate the end of life and what comes with that. Families need that help at that time, and it's one of the times that we can really help. There's very few times that people come back from saying, hey, thanks for helping me with my hypertension. But people do come back and say, boy, thank you very much for helping me with grandma or helping me with mom or dad. That was really tough. Being a physician is very rewarding. I get to go to bed every night knowing that I got to help somebody.